Hi, I'm Dr. Jessica Shepard, a board-certified physician specializing in women's health and Chief Medical Officer at HERS. This is your guide to high blood pressure. High blood pressure, also known as hypertension, is when the pressure of the blood in the arteries is higher than it should be. Blood pressure is measured with two numbers. On the top, systolic blood pressure, the pressure in your arteries when the heart is contracting. And on the bottom, diastolic blood pressure, the pressure in your arteries when the heart is relaxed. Normal blood pressure for most adults is below 120/80, and multiple readings that are 130/80 or higher would be considered high blood pressure. And nearly half of American adults have high blood pressure, making it one of the most common health conditions in the US. High blood pressure typically doesn't have any symptoms of its own and can often go unnoticed until getting the blood pressure checked or until resulting in another medical condition that does show symptoms. If blood pressure is extremely high, more than 180/120, it can cause symptoms like severe headache, chest pain, dizziness, nausea, and vision changes. This would be considered a medical emergency. High blood pressure can be caused by medical conditions like adrenal gland tumors, kidney disease, sleep apnea, and thyroid problems. Certain medicines and drugs can also increase your blood pressure. But for most people, there's no specific cause for high blood pressure, and this is called essential hypertension. Risk factors for high blood pressure include things like age, race, genetics, certain chronic conditions, and lifestyle factors like having excess weight or obesity, having too much salt in the diet, smoking or drinking excess alcohol, and lack of exercise. High blood pressure is diagnosed by measuring the blood pressure, maybe multiple times in multiple settings, to see how it changes and if it's always elevated. A healthcare provider could also run other tests like blood tests or an echocardiogram to find the cause of high blood pressure. Treating high blood pressure involves a combination of lifestyle changes and medications, and taking care of any underlying conditions. This means getting more exercise, managing stress, eating a healthy diet, losing excess weight, quitting smoking, limiting alcohol intake, and getting enough sleep. Along with blood pressure medications like ACE inhibitors, angiotensin receptor blockers or ARBs, beta blockers, diuretics, and more. Preventing high blood pressure is all about engaging in a healthy lifestyle, eating a balanced diet, losing weight, staying active, getting proper sleep, and managing stress. For healthy weight management, oral and injectable treatments are also available through online platforms like HERS if prescribed. If you're concerned about high blood pressure or interested in prescription weight loss treatments, be sure to connect with your healthcare provider. You can read more in depth and get a free consultation for weight loss treatment at forhers.com.